Does having a family history predispose you? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I have Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you are one of our established listeners, we are so thankful and grateful that you've been on this journey with us. And if you are a new listener, we are so grateful that you're taking the time to check us out. And I hope that you will jump on the train and go on this journey with us.
We've got a lot of catching up to do.
Yes, you do.
We've got over 360 some podcasts right now. So
absolutely, we've been doing this for quite a while now, several years, and so yes, please come on and join us and let's go through this together. We know that you guys are all busy, so the fact that you're taking time to listen to this means everything to us. So thank you. So what about family history? I think it's a great topic, because I see a lot of patients who have family history of colon polyps, family history of colon cancer, family history of other types of cancers, pancreatic cancer, stomach cancer, and even other cancers that are not necessarily in the digestive system. And so, we definitely have guidelines for family history of colon cancer. All right, we have guidelines in the gastroenterology that are put out by the gastroenterology societies. There's a task force, a U.S. task force. There's the American Cancer Society. Like, everybody puts out their guidelines. And so we know that if there is a family history in a first degree relative, like in your mother, father, or in a sibling, that definitely could put you at risk, and also depends on the age, okay? And if they're when they were diagnosed with colon cancer, for example, if they were under the age of 60, that definitely is considered to be a higher risk than if they're over the age of 60, okay? And but we also there's always a question of, so I was asked this question just recently, which is why I thought, this could be a good topic. The person asked me, in this case, the patient had family history of colon polyps in mom and dad. All right. So definitely is considered a risk factor. And so the question was, hey doc, so is it a pretty sure thing that when you get in there, you're going to find polyps, since my parents had both had polyps.
Was this their first colonoscopy?
This is their first colonoscopy, yes. Their first colonoscopy. And
did either of her parents have colon cancer or just polyps?
Nope, colon polyps. No, okay. Colon cancer, colon polyps. And so I told the patient, no, it doesn't mean that you're going to have polyps. It certainly increases your risk a little bit more as far as you having polyps, but it doesn't mean you're going to have polyps. Mm-hmm. And sure enough, the patient did not have polyps. Mm-hmm. So I was very excited to be able to tell the patient in the recovery room, after the sedation wore off, guess what? You had no polyps. Okay, so this was very exciting and
well, because a lot of it is, some of it is genetics, but the other part of it too is lifestyle.
Exactly,
right?
And so
especially with colon polyps.
Exactly.
Like, you might be predestined or predisposed to colon polyps because of a genetic issue, but it's mostly, I feel like, lifestyle. What are you eating? What are you drinking? Are you taking care of yourself?
Right. Exactly right.
So.
And so there's a field of science out there called epigenetics. Epigenetics is the study of genetics and how behavior and lifestyle and environment affects it, okay? Because you definitely can affect how your genes are expressed, okay? You're not going to change the sequence of that particular DNA, okay? Once that DNA is made, it's not like, the fact that you smoke is going to change that specifically. However, you can affect how the genes are expressed, okay? Because the genes are responsible for, let's say, for the production of proteins, okay, and that are made to affect the cell that it's in. And so epigenetics is the study of genetics and how what we do, our lifestyle, our
example,
environment.
Eating a lot of barbecue.
Yes.
Or not eating a lot of barbecue, right?
Yes.
The carcinogens from the barbecue can cause changes to the cells, right? So if maybe your parents ate a lot of barbecue but you don't, then that's going to, contribute to their situation versus yours.
Exactly.
Being exposed to chemicals on the job, right? There's a lot of jobs that have chemical exposure. Again, if you're exposed to a lot of chemicals in your job, but your children aren't, or vice versa,
right,
is going to change,
exactly,
the cell expression.
I mean, smoking is a big one. I mean, there was a time not that many decades ago, where smoking was like the thing to do. All right, smoking was cool, and smoking was everywhere. Okay, and over the last few decades, things have changed. I mean, there used to be smoking in restaurants. I mean, and I'm in my lifetime, I've seen that change where, restaurants have, for the most part, said no smoking in the restaurant. All right, airplanes. I mean, I remember as a child flying, and you had the smoking section and you had the non-smoking section.
Airplane.
Yeah, I always tell the story too, how, my parents were so happy and proud that they bought seats in the non-smoking section, and we would always be in the seats where the row in front of us was the smoking section, and so, I mean, and it doesn't matter. The smoke was everywhere. Yeah. The smoke was everywhere. So, and now there's no smoking on airplanes. So a lot has changed.
Can't even use your cell phone on an airplane.
Exactly.
It might explode.
Exactly.
Yeah.
So I'm a huge believer in that field of epigenetics. I mean, we're both huge believers in that, what we do, what we're exposed to, how we treat our bodies can definitely affect the genetic expression. Let's say the genetic
trauma.
Absolutely.
Trauma, especially trauma.
Emotional trauma.
Yes.
Oh,
all kinds of trauma. I mean,
your thoughts. Okay, all of that, because your thoughts affect the chemistry in your body.
Yeah. The cells,
they do.
Like when we do blood microscopy with people, and you take the live blood and you put it on a
slide, a glass
and
slide.
put it under the microscope. You can literally, like, if the person is really stressed out or has a lot of stress or trauma, you see crystals in the blood. Like, that's how much trauma and stress affects the inside of the body. So
yeah. So I mean, it is so true. I mean, all of these things. I mean, what you think. And look, here's the reality, right? We're never going to get rid of stress. Stress is always going to be there. There's going to be obstacles. There's going to be setbacks in our life. You're going to get a phone call, so-and-so died. You're going to get an email that really upsets you. And you can tell, right? Your body changes. All of a sudden you're sweating under your armpits. You feel this turmoil. People feel it differently. Some people feel it in their stomach. I'm a big one for feeling it in my stomach. I'll call my wife and I'll say, my stomach is really sick, and over a situation. So imagine, constant trauma like that, emotional trauma and stress, where your body is constantly on a fight and flight mode, and your cortisol levels are constantly elevated. All of that affects your body. It affects us, okay? So all of these things affect us, and it affects how your cells behave, okay? It affects how the DNA in your body, in every single cell, okay? Because every cell in your body has DNA, and it affects how things are expressed. So I'm a big believer that's, that disease starts because of all this stuff, okay?
Not necessarily family.
Yeah,
I mean,
not
family
necessarily.
history. Like you could
Right.
you could change your direction even though your family history.
Absolutely.
Right, right.
Absolutely. You can affect your own destiny,
Right.
okay? Your thoughts determine your destiny. How is that? How is that, right?
Yeah.
Your thoughts determine your destiny, because if you're always stressed out, if you're always sad, if you're always angry, if you're, all of that stuff affects your body. Also, how your thoughts affect your destiny also, because that's how you make your choices. Okay, your thoughts are what, you're going to think a thought to make a choice, to make a decision, to take an action. Whether that's, okay, I'm going to either have that bag of Doritos or I'm going to have that bag of spelt pretzels, which is a little healthy, which is a lot healthier. So your thoughts, your actions, all of that affect, okay? All of that affect your health. And the other thing is that I want to say is that by the same token of having family history of colon cancer, and I'm just using that as an example because it's the easiest, because I've had plenty of patients with family history of colon cancer where we go in and they have a normal colonoscopy. And I've also had plenty of patients with no family history of colon cancer who I find colon cancer on.
Right.
Okay? And I always end up questioning these patients in regards to their life and things that are going on. And I can tell you that I've had several patients who've been diagnosed with a cancer who can very clearly tell me that maybe a year or 2 years before, or it could be many years before, they went through some traumatic event. All right. Now, that doesn't always have to be the case. However, I have had patients who could clearly tell me, you know what, this happened in my life and my life has never been the same. I've been depressed, I've been sad, I've been, just a lot of emotional trauma. So anyways, I just wanted to bring it up as a topic because I thought it was fascinating, a great question that the patient asked me. And I just wanted to put it out there and say, look, you can determine your destiny, all right, by the thoughts, by the choices that you make. Very important.
Amen.
All right. Well, if you want to connect with us and if you want a free 30-minute wellness consult, go to our website, drlizcruz.com. There is a magenta colored button on the home page. You can click that and schedule a free 30-minute wellness consult. And you can do that from anywhere. It's done over the phone, and it's our gift to you. And if you have not rated our show, please give us a rating and please give us a 5, because that will actually help other people just like you to find us easier. And lastly, if you haven't subscribed, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.